everybody else calls mHealth, eHealth, Health 2.0, all that crap. Okay, so why should Boulder get off their ass and actually do something about helping us build healthcare? Well, we need the help. I'm addicted to improving healthcare. Addicted, absolutely, obsessively. And everything that I do is about connecting people who might actually be able to help me get that done. If you look like you do something useful, I want you to start fires with us. No, actually, this is what's happening to healthcare in the US right now. Okay, so it's a series of escalating events leading to combustion and epic fallout, right? That's pretty scary. But I'm one of those people who believes that we haven't reached mutually assured destruction yet, but we will. So why should you care? Most of you probably don't need healthcare. We need you more than you need us. But the good news and the bad news is that at some point you will be a patient. You will need healthcare. And at that point, it doesn't really matter what you do. It doesn't matter how many followers you have on Twitter, how many businesses you've successfully exited from, right? You need an anchor. You need something that's going to help you weigh in the system. So this is my story. I'm here from the patient perspective. I'm not a doctor. I'm not a nurse. I'm a crazy healthcare person. 8 years ago, I fell asleep at the wheel and hit one of those anchors dead on, crushed my right knee and ankle. Doing great. But I realized that I know more about my body and what works for me and what doesn't than my doctors do. I am now a hyper specialist in my condition. Well, good, maybe. I know I can do some crazy things. Bad because there's no way to communicate with my provider, with my doctor, the hard freaking won, subjective personal knowledge about my health care that I need to have a two-way conversation with them about where I'm going next. So this is the obligatory muscle shot from Tara, from Legit. So here's the problem with healthcare. We're increasingly going way up there in the cloud, right? Heads in the cloud. 80% of us doing online search, Google, other health search information. But when we need healthcare delivery, boom, crash, feet on the ground, brick and mortar, real world care. Let me tell you what that feels like when you get into the hospital system and you're a tech person. You are up Schitt's Creek without a paddle. I'm telling you, please, trust me on this. Build the paddle before you need it, right? When you get into the system and you don't have it, it really sucks, just really sucks. So this is what we believe, actually. Next Health, all the people that I work with, Martin Graver, the whole crew, semantic interoperability of health, ubiquitous healthcare, that consumers will, at some point, it's kind of cyborg, right? Access healthcare goods and services online and offline at will. So wow, the rest of my slide disappeared. I've got a naked guy up here. That's great. So I don't know what to do with that. Pun intended. Come on. So this is what's happening now. The only connection point within the entire healthcare system is the patient. It's their experiential N equals 1 knowledge, and is the most vastly underutilized resource in the system. So entrepreneurial types, what do you call an asset that you're not using? Fucking waste. It's an almost criminal waste in healthcare. And where's my... Okay, so again, you got the person in the center, consumer-centric, patient-centric care. That's where we're headed, whether you admit it or not. It's the only thing connecting all the bits and pieces. We're going online, virtually in the cloud, but we have to somehow connect that to brick-and-mortar care. Okay, we need tech to do that. Nothing else is working. We've got a patient in the middle here who's really confused. Your social networks are gone, your support systems are gone, you're no longer self-sufficient, you're a diagnosis. It's this whole patient identity thing, and like I said, it's like you're up Schitt's Creek.